Hi, everyone. Welcome to Tuesday's caucus. I think it's the 18th, and we're finally back in room 11, which for those of us who remember being here, pretty exciting. It was much more casual back then. We used to like sit on the desk and talk, and everyone was like around. So it's a little bigger, a little bit different setup, but hopefully we can be a little bit more casual now, just remembering we're still on YouTube. I'm Lori Houghton. I represent Essex Junction, and we'll start with our standard couple reminders, and then we, I think, only have two things on the docket today. So again, keep leadership know if you're going to be out of the building. We had quite a few people actually last night and today just text us and say, I'm sick, I'm not coming in. So it's really important that we know that. Floor times will continue 10, 3, 3, and 9:30 for the next 2 weeks. Then we're on town meeting break. Then when we come back, it will be 10 on Tuesday, 1 on Wednesday, 1 on Thursday, and 9:30 on Friday. So Tuesday, Friday stays the same. Wednesday, Thursday switches to 1. And remember, town meeting break is March 3rd through 7th. Crossover dates, March 14th for policy, March 21st for committee. This week, pretty short Thursday, we have the UVM trustee vote joint assembly at 10:30. People might be asking, especially new members, why H98 has been delayed. It has to do, first time it was delayed because the reporter of the bill was sick. And now it's been delayed because the reporter of the bill is having a grandchild. And so we had to do some switching around, and it'll be a new reporter of the bill tomorrow, and it will be up for debate on the floor. And this was in the speakers Friday update. Hopefully everyone's reading those. Again, it's around decorum. When you're in committee, there's plenty of seats if people want to come sit down. When you're in committee, we're here to ask really hard questions, and we should be asking hard questions. And we should be doing it respectfully, and we should not be debating our witness, right? It should be a respectful exchange. We're getting some complaints that it's gotten a little unrespectful in the last couple of weeks. So just want to put that out there. If you have any questions, come talk to leadership. So we have two things on the docket today. We're going to start with Representative Durfee for an update on universal school meals. Stand wherever you want.
I'm gonna stand here. What's the second thing, just so that I know what I'm.
What is the second thing? The second thing is Alyssa Black on certificate of needs.
Okay. Well, good morning, everybody. So I'm going to talk a little bit about the work that the House.
I have that process too. Here.
Yeah, that's actually the best.
Yeah. Yes. Yeah, go back.
There you go.
Oh, lovely framing. Very good. Thank you.
Oh, that looks good.
Yeah.
Great with time.
All right, good morning. Again, David Durfee from Shaftesbury. I'm here today to talk to you about the work that the Agriculture, Food Resiliency, and Forestry Committee has been doing on universal school meals, or the review that we've been doing. Like many committees, we were tasked with taking a look at a piece of the education fund, or an aspect of legislation or statute that affects education. 2 years ago, the committee, our committee, worked on the bill that became Act 64, enacting universal school meals in the wake of the pandemic and the federal withdrawal of what had been for 2 or 3 years a universal meals program. And we did substantial work. The bill ultimately passed easily through the House and the Senate, and then was not signed by the governor, but became law without his signature. So we took some testimony last year just to check in. We saw that the program was working as expected, meaning that more children were being fed during the school day, and that it wasn't costing as much as had been projected earlier that year. And now here we are today, having taken more testimony and hearing essentially the same feedback that the program is working as expected, and it's costing even less than originally projected. I won't bury the lead here, I guess. I'll say that our committee last week on a straw poll voted unanimously to support the continuation of universal school meals. And we'll be sending a letter to that effect to the Education Committee and the Committees on Appropriations and Ways and Means to that effect, spelling out our reasoning. Some of the reasoning is programmatic and some of the reasoning is fiscal. When you take a closer look at the education fund and the way that school meals programs work, you see that the line that's on the budget, it's 18 some million dollars, doesn't really capture the actual expense or the actual savings if the program were eliminated. And there's a couple of reasons for that. But the bottom line is that there would be very little expense, ultimately, very little savings to the ed fund if the program were repealed. And if no district individually on its own decided to have a program. That seems unlikely, since before the pandemic, before there was universal school meals across the state, many districts did have that school meal program. And those are costs that were borne and would be borne by the education fund going forward. Aside from the education fund, participating in universal school meals draws down federal dollars for other summer programs. And I guess one way to think about this is that there's whatever we put into the education fund, if we have universal school meals, there's also federal dollars that come in directly to schools in the education fund that essentially match that. It's more or less one-to-one. That's all cost that would be borne by parents if we got rid of this program. And we would be not saving the state any money collectively. We would be actually putting a heavier burden on parents than they have now, and a much heavier burden. So again, our committee took testimony on all of this, and with very little debate, we'll be sending that recommendation off. I'm getting the hook.
No, I'm just, you are done.
And I am done, actually. So
We're winding down.
I'm done except for questions.
Yes,
Yeah.
any questions?
Thanks, not a question, but more of an observation. Friday, we had the AOE come in and present their budget for the next fiscal year, which also included the education fund. And I just want to point out that in that presentation, you'll see that they pulled $20 million out of the education fund for the universal school meals program, meaning they eliminated. I asked the question, did you rework in the cost of operating school meal programs back into the individual budgets of each and every school district in there? And they said they had not. So it's just a clarification for those of you who might be looking at the AOE budget presentation, that one of the missing pieces there was that they did not work back into the education spending line the cost of operating school district lunch programs, which nobody has said. Without universal school meals, we're never going to have a lunch program here.
Karen, Phil.
Phil Chinese-Burg. Thanks for this. Is it working?
I'm not sure it is.
Perfect. Very. All right. Thanks for doing this. A question: did you take any testimony or discuss the use of local farm products in the schools, and has that increased, and have they shown any other additional benefits?
Yes, we did take testimony, and yes, we have. The testimony showed that there has been more local purchases as a result of the school districts being able to actually spend more money. We have a local purchasing incentive that schools are eligible for right now, that if they buy products from, within the state of Vermont at a certain level, they are incentivized to do that. So yeah, thank you for mentioning that.
Candace, and then I think Bram would have, no, Candace, and can just talk loud since we lost the mic. And can you introduce yourself, please?
Candace White, Field. So just a clarification on the funding that you were talking about. So $18 million program, it's about 1-to-1 federal to state, so 9 million state, 9 million.
Sorry, no, I probably should have been a little more careful when I said that. The federal funding that's being brought down will be around 17 million.
And the cost.
The additional federal funding by having universal school meals, yeah, and the dollar amount that's currently estimated, I think, is 18.5 for the education fund.
Okay, so 18 federal, 18 state, roughly.
That's yeah.
Okay.
And again, that's so if we didn't have a program, all of that cost would be borne by families if they decided to buy meals for their children, or were able to.
Sarita and then Emily.
Representative Sweetos from Colchester. I'm thinking that families are probably saving, $1,200 a year by not having to pay for breakfast or lunch for their children. I'm just wondering if we're seeing any of that, if we're following that or seeing any of that in our economy.
So we heard the figure, thank you, Representative Austin, we heard $1,500 per student is what the expected cost would be. We didn't take testimony directly on whether we were seeing the impacts of that on the economy. We did hear that local purchases have a multiplier effect of 1.6. But we didn't really have time to get too far down that road.
I have a question. Did you take tests based on what Representative Conlon said? Did you take testimony on if we did do away with universal school meals, what the cost would be to districts to reinstate a school lunch program or breakfast or both?
Yeah. Yes, and and one thing to just point out, and I think this gets to Peter's point too, that many, I don't know whether it's most, school budgets for next year have already been warned and will be, on the floor or will be voting at town meeting day. Those budgets don't have any of them, as far as I know, funding set aside to run a universal meals program. So there would be a year where there'd be some question. I guess districts could use reserves, or they could pull money from another program, or they could deficit spend. I mean, it's in theory, it's a possibility. But yes, to the question, we heard, and I think this is a USDA figure that came through the Agency of Education, that statewide there'd be about a $5 million cost annually to, if every district were to just use a paid program. And that's to cover administration, setting up systems again. When we took the testimony 2 years ago, we heard a lot about administrative staff time spent chasing down bad debt, unpaid accounts. And ultimately, if those accounts aren't collected, the school district has to pay them anyway. That's the federal law, that they have to reimburse the food system. So those are just a couple of illustrations of why we think that the top line $18 million figure is overstated in the first place. And it is probably much closer to something like 10 or 11, 12.
Sorry, I was looking for a mic, and then Brenda wasn't. Emily Brunkheiser, Chair of Ways and Means. Just sort of to build on everyone's points about the math here.
when we talk about and maybe everyone's been paying so much attention to ed finance this session that everyone in the room knows this already. But when we talk about dollars being borne by districts, if this program sort of devolves back to districts and district decision-making, that is still dollars out of the education fund. That's not dollars that just sit in local districts. So we're essentially just moving costs from one line item to another. We're not reducing costs for Vermonters. We're likely increasing costs for Vermonters. And I'm curious, Representative Durfee, that sort of cost to operate the program of $5 million, is that ongoing operation, or do we need to actually pay for brand new cash registers all over the state in addition to that?
Yeah, that's cost to operate a paid program. So, right, if we didn't have universal meals. But possibly, it's possible that some districts still have registers in place, even though students aren't paying for their meals because teachers and others may have a card and a swipe card. So they may be mothballed. It's been 5 or 6 years now, right? And if you're a fifth grader coming in September, you've never had to pay for a meal. We've seen evidence in other states because most states didn't do what Vermont did. I think there were only 7 or 8 states that had their own program. Most states went back to a paid program, and we heard that the incidence of bad debt was higher than ever in those states for, I think, understandable reasons.
Great. And I think we just need to always remember the student at the center of this, who is being fed and is able to learn through the day. And it's a good thing all around for our future.
Yeah, and I'm sorry, I mean, I did not lead with that or the farming piece. There are lots of different ways to look at this question. We were tasked with what is the dollar impact on the education fund? It's pretty small, if any.
Yeah, great. Great, thank you for the good work from the committee. So that letter will go to the necessary committees. It'll be on their webpage in a couple of days, so you'll be able to pull it down and have it ready for talking points for town meeting. Next, we're gonna have Representative Black come up and talk about a bill they're working on in healthcare on certificate of needs.
Representative Alyssa Black, Essex. I'm going to give a really high level of what we're working on with certificate of need, mainly because please understand we have some language which is still being drafted yet. So I don't really want to speak to a lot of that, but essentially various healthcare projects, facilities, diagnostic imaging equipment, all has to currently go through a certificate of need process through the Green Mountain Care Board. And what triggers that certificate of need is sort of the monetary threshold that something may cost. So there's general agreement by everyone that the process is onerous. Most of it is unnecessary, and that it's restrictive for any sort of competition, which ultimately just leads to higher medical costs for all of us. So we're tackling this. The bill is introduced essentially was just raising thresholds, and we've raised those significantly. Just for an example, previously, if the cost of construction was over 1.5 million, it triggered a certificate of need. That is going up to 10 million. I think we've got general agreement that 10 million is the right number on that. If you're purchasing or leasing equipment, diagnostic or therapeutic equipment, it's anything in excess of $1 million. So think about things like a CAT scan machine. So if you want to purchase one of those, you would currently be triggered. You have to go through a CON process. That's being raised to 5 million. And the annual operating costs, it's in statute by at $500,000, but these are indexed currently. I think we heard testimony, it's currently like 650,000. So if a facility is opening with an annual operating cost of more than $650,000, which frankly, in the world of healthcare, that's not very much. That's being raised up to 3 million. We are waiting for some draft language around, possibly putting in something so that you would have to go through an initial jurisdictional application with the Green Mountain Care Board to say, here's our planned project. Here's what we're anticipating, our costs are gonna be, and receiving sort of an expedited review by the board to be able to then proceed if it doesn't trigger the certificate of need. We've added some exemptions in for projects that also don't require exemption or certificate of need. One currently in this bill, this is H96, by the way, I don't think I mentioned that, is that if it has been state approved, then it would not need to go through the certificate of need. Because if you think about that, the state has put out an RFP, the state has identified that this is something that the state of Vermont, a service that the state of Vermont needs. It's gone through the legislature, we have appropriated money for it. And the thought is, why does it then need to go through the Green Mountain Care Board process, which can take years, by the way, just years. We currently, we appropriated last year or the year before, 2 years ago, we appropriated $10 million for adolescent mental health beds at Southwestern Vermont Medical Center for adolescents who have a mental health diagnosis with a co-occurring medical diagnosis. Currently, there are no beds in the state of Vermont in order to treat effectively these children. And that project is still in the certificate of need right now. So it hasn't even been started. $10 million we appropriated 2 years ago. Still don't have those beds online. There's some other exclusions which are not in this bill, but there was a companion Senate bill that will exclude ground transportation, emergency medical ground transport. So basically, if you need to buy a new ambulance, you don't have to go through a certificate of need process. And also for fully depreciated equipment, right now, if your MRI machine breaks, you got to go through a certificate of need to get a new MRI machine. That's going to be an exemption also. Anyways, that's a high level of what we're working on. My hope is, and it's aspirational, my hope is that this will be voted out by Friday out of our committee. So probably see the floor next week sometime.
Any questions?
Any questions?
Thanks. Angela Arsenault from Williston. So, Alyssa, you mentioned the potential like initial review by the Green Mountain Care Board. During that initial review, could the Green Mountain Care Board say about a project, we're going to require a certificate of need, even if that project doesn't meet any of the financial thresholds?
We have not seen draft language yet on this. But the intent is in that language that they will only be able to trigger the certificate of need below the dollar thresholds if it meets very, very defined characteristics. And well, we keep referring to it in our committee as the bad actors. If you want to open a medical facility for something that is completely non-evidence-based treatments, then that is something that the Green Mountain Care Board could say, wait a minute, we want you to go through a certificate of need. So, it's sort of a consumer protection more for Vermonters than anything else. But it would be very small defined things that they would be able to do that for. Not just, oh, we don't want one of those.
Teresa Wood from Waterbury. Maybe 3 or 4 years ago, maybe it's longer now, we removed certificate of need requirement for nursing home transfer of ownership. I just want to make sure.
It doesn't touch that. That's still there. Yes. Yeah. And we do have, there are other areas within our healthcare system that we do have other certificate of need type things for, and this touches none of that. So, yeah, that's a really important one.
Any other questions? Edie?
Hi, Edie Browning, Jericho. You've said a lot of things that make me wonder how a certificate of need benefits us in the state, and I'm wondering if you could just give us a high level on that, because it seems like we're reducing the use of it significantly, and so where is the benefit to us?
That's a hard question. Originally certificate of need was a federal requirement back in the 70s. States were required to have this in place. It was thought that it would keep healthcare costs lower. I guess the principles of economics at that time, supply and demand didn't translate. That was repealed federally way back in the early 80s. And the federal government has actually been encouraging states to repeal all their certificate of need requirements that they have. And a lot of states have, some haven't, and ours really hasn't. So we're tweaking and changing them.
And I'll just add, we only have 600,000 plus residents, right, in our state. So we have a very small pool. And so we don't want another hospital coming in, right? We have 14. We don't need another, larger thing coming in. So being able to increase the thresholds instead of just repealing it gives us an opportunity to look at what that will do and how it will allow our hospitals and other providers do the things they need to do with less cost and less paperwork and less time, while still preventing, some major players coming in and upending with such a small pool of people. Any other questions? Great, thank you. We have Representative Christie is online. Sorry, couldn't come up with the word. Is online, and he wasn't able to be here when we introduced the nominees for UVM trustee. So he's going to pop on, I hope, for a quick. Yes, please. 3-minute introduction to who he is and why he's running for trustee. There he is.
Good morning, everyone.
Morning.
Oh, a nice winter day in Vermont. When you can always count on your plow person not to be there, just to make life interesting. But anyways, I do understand we have 3 minutes to speak to you. I will not use that full amount of time. As I stated in the letter that I sent to everyone this morning, as I was thinking about the re-election run altogether, I've given a lot of thought to how I roll, so to speak, and thinking about how, although you're a member of a very large board, the impact that you can have by your presence and participation, even in that circumstance. And, I'm proud of the fact that I've been able to represent us our legislative democratic body at UVM, and kind of continue, the work that I've been kind of involved with all of my career, here in Vermont, which is a little scary to think goes back to 1973. That being said, it's about helping young folks and others develop I'll call it a Disney Imagineering approach to development. And that's not, like taking anything off the table, so to speak. Keeping the ideas as open-minded and as broad as possible. That is the key. And so over my first term, with the board, that's what I've attempted, to do, is to be that voice, of the legislature, thinking in broad terms and how we can ensure that our flagship university serves Vermonters the way it was originally intended to do. It's not just about the big achievements. The championships are great. The awards are great. Getting large grants are great, but it's the service to the students. I ran into a parent at one of the events, and I was just kind of hanging out, and this lady said, "So who are you?" And I said, "Well, I'm a trustee here." And she said, "I need to tell you, your school saved my son's life." And that's striking when you think about it. And that's what occurred because of what we collectively as a legislature do to keep that university strong. It's created an atmosphere and a place where kids can find their way and become the young people we would all hope them to be. So that's my spiel, and I'm sticking to it. And I would really hope that you would give your support to my candidacy, and have a great rest of your day.
Great,
Thank you.
thank you. Good luck. And I apologize, I am still on weekend mode because I forgot we talk about education everywhere we go. So we still have our education road show to happen, and then we're really done.
Like a synchronized dance at this point.
Given that, we'll be fairly quick, at least our side. So just to kind of update as to what our committee is doing, at this point, we still don't have a bill reflecting the governor's transformation plan. But we are moving forward in the committee on taking on some of the big concepts. And probably starting tomorrow, we'll be putting on the table a number of topics. We'll probably do this in the form of a committee bill or just pieces of language to start with. And these are sort of commonalities with some of the themes that we have heard within the governor's proposal, but also from many other areas. So among the topics will be class size minimums, reducing the number of school districts and supervisory unions, sort of based on maps and lines that exist, appropriate school sizes combined with school construction, statewide graduation requirements, statewide school calendar, topics like resourcing the State Board of Education sufficiently, because if we're going to make significant change, that's going to mean significant rulemaking. And that rulemaking lies with the state board, and they currently have a budget that does not really allow them to do the things that we've tasked them with previously and the things that we would be tasking them to do here. Really what we're doing is looking at what is achievable in the time we have left in the first half of this 2-year biennium, and really moving forward with that and what we can accomplish. as we look at sort of the governor's piece, we're also still awaiting from them a couple of big missing pieces for us to consider. That would be career and technical education and pre-K, in terms of how they fall into the bigger package. It's going to be a question of looking at this as both opportunities for children and really how do we restructure our education system with an eye towards affordability now and affordability in the future.
Thanks. So the Ways and Means Committee has received legislative language from the tax department on the fiscal side of this reform package, not in the form of a bill, but we do have that legislative language. However, a good education finance system supports good education policy. And so we cannot go very far forward in that language unless we're able to match it up with the policy it's designed to support. And so we are in a similar holding pattern with regard as the Education Committee. And as I've said here before, and as you all know, the details really, really matter. They matter for our kids, they matter for our schools, they matter for our strong communities. And so we are doing our best to dig into those details in Ways and Means. Some pieces of detail that we are digging into is property tax reform. That includes making sure that we are appraising properties in a way that is equitable. If we have a statewide education fund, we need to make sure that properties are being appraised in a way that is both equitable across the state, consistent across the state, and gives us the data and the tools we need to be applying taxes and tax rates in a way that meets our policy needs and goals. We are also looking at the governor's proposal for property tax credit changes. Right now, as it has come to us, it looks as if most Vermonters would wind up paying more. I don't think that's any of our intentions this year being here in the legislature. And so we are working with some of those constructs to really explore who pays and how, and making sure that we have a system that is fairer than the system that we are operating with today. Speaking of the system that we are operating with today, I'm going to just get a little bit philosophical for a moment. I think that all of us run for office with a certain degree of hubris. It takes it in order to show up in this building and think that we can make a difference for anyone at all, right? And I think that's true for a lot of people who go into any sort of government work. And often, once we get it here, we realize that we are putting Band-Aids or duct tape or filling in cracks with some caulk, whatever it is. And that gets a little frustrating. And I think with these big, bold proposals, we can get very excited that we are creating a system anew. And we heard some testimony on Friday in a joint hearing with a consultant who's worked a lot in Vermont and a lot all over the country, who said in testimony, he was very excited about the idea that we are creating a system from scratch. However, we are not creating a system from scratch. We have thousands of children going to school right now all over the state. We have thousands of teachers and staff working in our school systems. We have folks dependent on our schools and our communities in order to live quality lives and build strong futures. And so as we do this work, again, the details matter because we are not creating something from scratch. We are working with real people, with real lives, and we need to design policy and finance that will help us today as well as take us towards that sustainable future that Peter described. And so as we dig into the details, I just want to make sure that folks are exquisitely aware that we are very mindful of the transition and the feedback that we are getting very regularly from the field, and that I think we're all really grateful for, is really helping us understand what is happening now and what would be the implications of something happening tomorrow. So just wanted to thank you all for that. And flag that in the speaker's email that she sent out on Friday, feels like 12 years ago, was a discussion guide that a couple of our members put together for us. Really grateful for that. And that is an opportunity for you to be taking back to your communities either before or during town meeting week to have meaningful conversations where your community members can really help you understand what is and talk about what will be. All of this work, as we've said before, requires various trade-offs and priorities. And I think it's really helpful for communities to be sort of discovering that for themselves rather than us or the governor trying to sell anything. So thank you all, and thanks for listening to me and Peter talk all the time.
Any questions? Teresa?
Last night, a few of us attended a local, a meeting with our local education association and superintendent. And one of the things that was brought up was potentially unintended consequences of legislation that we've already passed. And they brought up a special education bill that locally, they said at least has resulted in over 50 more students actually qualifying or receiving IEP services. And my recollection of the bill was actually we were going to reduce the number of making it easier for kids to get supportive services, but not necessarily having to, be labeled with an IEP. And that ultimately it was intended to reduce special education costs, and they attributed about $2 million of increased costs to this bill that we passed, and that's just in one school district. So they wanted to know, what's the process are we using to review, bills that we, I know it was the implementation was delayed for several years, and I'm just curious about, is anything on the table that we're reviewing that special education bill that we passed and how it's being implemented?
That's a big question. So Act 173, which is the bill that we passed in 2018 to really revamp how we did special education with an eye toward allowing school districts to use their special education dollars to do earlier interventions so that fewer kids would later be identified as needing an IEP, which is a very expensive way to go through things. It's funny, the same consultant that Emily just referred to at our Friday joint testimony was one of the lead consultants in the design of Act 173. And so I asked him at our joint hearing, here we are 7 years later with Act 173, and its implementation has been, I said, uneven at best. And that's a fairly charitable, I would say, description. And it was interesting. He was very clear that if you were going to put in something, a change as Act 173 envisioned, and Act 173 had basically universal buy-in, that you need sustained support from the agency of education, staffing and in the field assistance over a course of a number of years. I think he said 5 years. That's not what we had. It really, between COVID and staffing problems at the AOE and their capacity, that's not what happened. I still believe Act 173 was one of our biggest potentials for bending the cost curve on special ed. Vermont is an outlier when it comes to special ed spending. But it needed to follow the original outline of really significant support from the agency of education. I will admit, in my mind, it brought up, okay, if we had been unable to successfully introduce that relatively, in the grand scheme of things, narrow level of change, what is our capacity to introduce huge levels of change?
Yeah, I think that's really relevant question. And, the teaching staff that we were meeting with, were frustrated with what they perceived as imposition of policies at the state level without really the guidance to carry them out. So they're doing the best that they can, interpreting it the way that they are, which may or may not be the way it was intended.
It calls for a wholesale change in how we provide supports for students who struggle. When you hear people talk about multi-tiered systems of support, this is really what we're talking about. It's new. It needs a lot of professional development in order to be successful. that still needs to happen.
Yeah, and what they ended up with was a bunch more kids on IEPs, the exact opposite of what was intended.
Any other questions? Candace and then Molly and then Sarita.
So Candace White from Waitsfield, just to piggyback on what Representative Wood said, because I was also at that meeting last night. A real concern from people in the school world about some of these proposed changes and consolidation and, looking at Act 173 and the intention versus the outcome. We're talking about consolidation on such a level. They're expressing a real need, which I think we all feel, that we need to be seeing actually seeing how the cost savings is going to work before we go down this road of really significant change. And the superintendent had done some financial gymnastics where he was projecting what the new cost per student would be, and they were seeing some real, I think they said like gutting of their programs, just so, kind of panic. I don't know how he's able to extrapolate the costs. He talked about the Caucus report, and I'm not kind of at that level of figuring that out, but just wanted to share real concern for seeing how this might impact school budgets.
I would love to publicly acknowledge how extraordinary your superintendent is and how much I've enjoyed working with him and hearing from him through this last year. We are doing our best and doing a lot of work to really dig into the Agency of Education's spreadsheets and their consultant spreadsheets to understand where they think the cost savings are coming from. A lot of their modeling does not reflect the true cost of education at this point. And so taking the numbers from there and then sort of trying to impute savings is frankly not possible right now. And so we are just continuing to dig in to make sure that we are actually understanding their proposal and that their proposal is matches current data that's available. And so we are working on that, and the field is being a tremendous support in figuring that out.
Molly?
Molly Mark, Delaware. Thank you for the work you're doing in this. It's really heroic. I want to build on what Candace said, that's my concern. I think the assumptions of the administration are that larger class size and fewer districts is going to result in savings and better educational outcomes. So, how can we really challenge those assumptions and, into what we were just talking about? So that's just my concern is some big changes that don't really result in what we are trying to fund. And I appreciate all the work you're doing.
Thanks, Molly. Sarita?
I'm just wondering if you have any sense of when you will get something from the administration with details, because I feel like we've been here before. And, time is running out, and I feel like it forces us to make decisions without being intentional, looking at data, being, strategic, getting, it's just frustrating to me because I don't think that's a good environment to be making such important decisions. And we obviously need his plans and his details. And I'm just wondering, have you heard when they're coming?
So I stood up here and made predictions previously. I'm not going to do that today. But I am going to say that time is running, and we've got concepts that are frankly spurred by many conversations, including with the administration and their plan that we are going to put on the table this week.
Great. Any other quick questions? Jay?
Will you be discussing the number of districts committee this week?
Yeah, probably.
Jay Hooper, Randall.
Thank you.
In the Ways and Means Committee, we are starting to do modeling and putting modeling forward on both appraisal districts and formula districts. We are using the number 12 just to be able to have the conversation. It is not a policy decision at all. Please don't take a policy decision from it. All the models are built so that we can shift those numbers around as we receive policy decisions. We just need to start seeing how reactions and interactions happen amongst the numbers. So if we plug a number in, it's not a permanent number. All the numbers are changeable based on policy decisions.
Thank you both, and thank you to the committees for their hard work. And that's a wrap.